epidemic is estimated to have killed about 2.5% of its victims, about almost 700,000 people overall at the time in the United States, 50 million people worldwide at that time. Measles kill about 1 in 500 people, and the bird flu, that epidemic that we had back 10 years ago, that's more like 2 people in 10,000 died from that. So it just gives you a relative estimate. It's not as bad as its MERS and SARS neighbors, but kind of on the order of a really bad influenza pandemic. And so that's the concern. The virus, as you may know, came from bats originally, and then somehow, as we say, spilled over and into being able to infect some terrestrial animals. Maybe it was a snake, maybe it was this anteater, maybe it's something we haven't figured out, but then got into people through the animal markets and now has spread around. States, and in particular in King and Snohomish counties. Our current counts of cases total in Washington State, we have 18 cases total. 6 of those have deceased. Now I want to emphasize those are 18 detected cases that have been diagnosed, and we imagine that there are many more out in the community, maybe who knows? I can't say exactly. A recent study estimated that up to several hundred might be out in the community. If we have 6 deaths and we think 2% mortality, that might suggest there might be around 300 people out there, most of whom, because they're not presenting for care and getting hospitalized, are indeed having mild to moderate illness. The challenge for us all is that it is being transmitted from person to person. In Snohomish County, we've had 4 cases confirmed to date, and of course, sadly, one of the 6 deaths is in a Snohomish County resident. There are 10 additional people who have been tested and have been negative, and 8 who are being tested and whose results are pending. Many, but not all of those are hospitalized. The others are isolated at home if they're not requiring hospital care. So I think that brings us to, well, what are the public health measures that we're doing to employ, or that we're employing to try to control this? And so there's the medical care for the people who are really sick and in the hospital, and that's what I've described. But we're not only concerned about the well-being of those individuals, but the other 800,000 people in Snohomish County and 7 or 8 million people in Washington State. So what are we doing? Well, as you may remember, I'm just going to kind of go down a list. We began with some travel restrictions to try to limit entry of folks who might be coming from high-risk countries where transmission was occurring, or if we were letting them enter, then screening them for fever and isolating them if they had symptoms. That didn't generate a whole lot of new cases, maybe 1 or 2, I think, or it generated a couple people that got isolated and tested, but I believe no new cases. But then hundreds and hundreds of people who were well and then entered and have been monitored by public health. I think a dozen or so of them have been tested, but I don't think we got any new cases out of those returning travelers. So then, as we've started to detect in the past week or so this person-to-person transmission, rather than importation of people who were acquired infection overseas and then came in the country, we're really trying to focus on everyone taking actions to protect them. Things like hand washing your hands with soap and water frequently. If you have any of the limited amount of hand sanitizer that's out there, carrying it around with you and washing, before you eat. Cough or sneeze, okay? And then covering coughs and sneezes with Kleenex, throwing the Kleenex away, washing or sanitizing your hands. If you're coughing or sneezing, go home, all right? Fever, cough, cold symptoms, we really want people not to be in group settings. We want you to stay home until your illness is resolved for 24 to 48 hours. We realize that's logistical and economic impacts, but the situation really merits that and requires it. We continue to try to isolate infected individuals, and at least for now, we're trying to quarantine their close contacts and their less close contacts who we think were less exposed and at lower risk, still trying to monitor them or advise them to notify us if they get ill, and of course arranging testing for any of those people if they get sick. We're working with healthcare facilities to help make sure that their patient flow processes protect other people in the waiting room, the healthcare providers who are important for all of our care for this and all the other things we need them for, and trying to prevent transmission between people or to healthcare providers. And then, then we start looking at things like social distancing. If you don't need to go to a crowded place, maybe think twice about that. And then there's a whole list of related interventions called non-pharmaceutical interventions. That relates to influenza, but we're adopting it for this. There is no pharmaceutical intervention other than the experimental drug I mentioned, so everything we're doing is a non-pharmaceutical intervention. But things, all that, personal hygiene and respiratory etiquette, as we call it, going home when you're sick, covering your cough. But then, getting a little more intense, things like voluntary home isolation when you're ill, even if you haven't been specifically diagnosed as coronavirus. We haven't moved to recommending this in general, but we could reach a point where we say not only the sick person, but their household contacts, the family ought to stay home until they pass through a particular incubation period. We're not telling that people to do that now, but these are the types of things we could consider as time passes. That could expand also to include, again, discouraging mass gatherings, as we call them. We're, in essence, a mass gathering here today. Sporting events, the high school basketball game, the hockey game, the convention. These things could end up becoming temporarily discouraged, if not, if possibly prohibited, depending on the escalation of concern. And then, at least conceptually, if you ever have read, novels or books, The Plague, where they cordon off an area and say no one leaving it, no one entering it. Sometimes you're trying to protect the people on the inside, sometimes you're trying to protect the people on the outside. That's the formal term for that is a cordon sanitaire. But these are some of the types of things that we think about. So going forward, we try to work with our with our state and national public health experts on what makes the most sense for the setting, then try to think of all the potential secondary impacts and make the best decisions that we can for the community as we go forward. So with that, I think I'd like to stop with my part and hand it over to Sean.
Thank you, Dr. Spitters. Good evening, everybody. As you've heard from Chair Wright, the Snohomish Health District is fully activated. This is our highest priority in responding to the coronavirus. Since January 20th, we've had over 30 staff members that have been directly involved in the response in our incident command. With the rapid shift we've seen over the last putting out the needs of the healthcare community and communicating with other partners and making sure that we are coordinating with everyone involved with this response. We're working with hundreds of local health care providers as we partner to evaluate, test, and treat accordingly. We're taking calls from them day and night. Our staff are making regular symptom check calls with close contacts of the confirmed cases and providing them with support For some of those people who are at home, that support could simply come in the terms of someone to speak with or coordinate specific needs. It could be groceries. But we do those things that need to be done to make sure that that our contacts are taken care of. We're generating really pages of new fact sheets and guidance every day for our partners and the public to answer specific questions and help them understand what to look for as concerns grow about symptoms associated with the illness. You've likely heard that in the first few weeks, the Health District has spent approximately $125,000 in response to this event, mostly in minor supplies and staff time. A lot of that is offset by normal operating. Checking out at 6 months, this is an event that could easily exceed over $700,000 in direct costs to the agency. There's likely some capital expenses and other large supplies, particularly as we look to stand up some of our more complicated efforts, such as developing the capacity to have a home assessment team, a group of highly trained individuals that would be able to go to individuals' homes, collect necessary samples, and prepare them for testing at the state and, if need be, on to CDC. Looking forward, there's several things that we'll see happening at the Health District. First and foremost, we're going to continue all of our efforts working with the local healthcare community and doing everything that we can to protect the health of the citizens of Snohomish County. But as Dr. Spitters mentioned, there will come a time when we look at our containment efforts, and there will be a pertinent place to really start focusing on mitigation. And a lot of those mitigation steps really are focused on the social distancing aspects, working with the wider scope of partners in the community, in the private sector, and really taking very, very specific steps to make sure that on a broader scale we're doing everything we can to protect the community. So really those are my very brief comments about the operations of the Health District. I would really like to take this opportunity to turn it over to Executive Summers.
Thank you, Sean. Good evening. I'm Dave Summers, Snohomish County Executive, and I just want to take a couple minutes to outline some of the steps we've taken at the county level to support this effort. I've asked to be drafted, and we're reviewing an emergency declaration for Snohomish County. Expect that declaration within the next day or two. And what that declaration is really intended to do is to help us mobilize resources. It streamlines procurement regulations if we need it, gives us some ability, particularly for things like if we have sick employees, we can send them home. So it's really a streamlining and facilitation declaration aimed at improving our operations. We have partially activated our emergency management system. Over the weekend, we stood up our what's called the JIC, or Joint Information Committee, which is intended to make sure that all the partners that are involved in this effort are coordinating their communication, agreeing on information, getting absolutely the best information out to the public that we can possibly get out. That JIC is part of the JIS, which is Joint Information System, which the cities and our other partners are also involved in. So our goal with this whole process is to make sure, again, that the public is getting absolutely the best and most up-to-date information they can. And I guess I would commend you to the Health District's website and also Snohomish County's website that has a link to those sources of information that we think are absolutely the best sources of information. We also, this afternoon, stood up our first meeting of our policy group, which again is the Health District, Sheriff's Office, county departments, and other players. We will be meeting every other day for the near future to discuss actions that we need to take, policy issues and questions, and make sure that we are all working in a coordinated fashion, in a unified fashion, and determining the best course of action as we go forward. So that really is part of our emergency management management system. It's employed frequently for emergencies and disasters. It's a familiar system, and we all work great as a team together as long as we understand what each of our roles and responsibilities are. The Health District clearly has the authority and is the prime director of public health issues when it comes to other health and other safety issues and other things. Other players such as the county take a role, but that policy group and that emergency management system will help us coordinate those efforts. We're also coordinating. I received a call from Senator Patty Murray this morning. She assured us that she was working at the federal level to make sure that what resources can be mobilized by the federal government will be, and so they're very aware of the situation and know we're going to need some help. We are also working closely with the state on these efforts at a state response. Similarly, talking with our cities, Mayor Franklin's here today, but we'll be working with our cities to coordinate our responses. I think the public is best served when we're working together in a consistent fashion and they're not getting mixed messages, so we'll be working really hard on that. And I'm also in contact with Pierce County and King County and our other partners there to try to coordinate our efforts. So those are some of the things we're doing here. Again, we're making sure that we are coordinated and working together. As was already mentioned, this particular outbreak is one that for many or most people does not really present a serious health concern, but for certain vulnerable populations it does. It is significant. So not to downplay it, we know a serious response is warranted, but we're trying to also make sure that our response is appropriate and effective as we go forward. So that is what's happening at Snohomish County. And who am I supposed to turn it over? Jason, would you like to? My emergency management director, Jason Bierman.
And Executive Summers covered much of what we're doing from DEM. I will just add to Chair Wright's point, we are a resilient county. We've been through crises before. We've worked together before, and the Health District has been strong partners since the announcement of the first case. We've been working and in communication with them since January. As the executive mentioned, we've set up a system so we can get public information out. Today we convened a group of the agency heads. The way our comprehensive plan is structured, we have functional leads for different agencies and different functions, and we convene them today to bring them together to make sure that we're bringing our plans in line and synchronizing all of our efforts. My staff now, we are activating our emergency coordination center at its lowest level, so we have staff dedicated to monitoring this and can be very responsive to either expanding that depending upon what the Health District or any of our partners need. But so we have someone who's constantly monitoring what's going on. And then moving forward, as the executive mentioned as well, we're looking at what are some of the bigger implications across the community and how we can mitigate some of those. We have been in constant contact with the state in the emergency management realm as well, and as well with our partners around the Puget Sound region. We'll be convening a call with a number of counties tomorrow around the Puget Sound region to discuss what every emergency management agency is doing and how we can better coordinate our efforts and our asks of the state.
Guess that leaves me. So I'm Cassie Franklin, Mayor for the City of Everett, and what we're focusing on, and I encourage all our other cities and communities to focus on, is preparedness and prevention. So that is really where we need our families, our businesses, and our residents to be focused. I know that can be hard because I think we're all really wanting to act and do something to prevent the spread, and the best things we can do are the things that our Health District is posting, which is simple hand washing and staying home when you're sick and staying informed. So we're working in close collaboration with the Health District, with Snohomish County. I think that's something that we really are fortunate having in Snohomish County is that spirit of collaboration. So all of us working together, we're going to get the most up-to-date information out to all of our surrounding cities and our residents' businesses as quickly as possible. The Health District has been working 24/7. I know because I get your updates every hour, so thank you very much for the incredible work you're doing. our first responders are doing everything they can too. And so you'll see some of our firefighters and our healthcare workers wearing masks, wearing gear. That is really out of an abundance of caution for their health and well-being, as they're there to serve our most vulnerable residents. And so they need to be wearing that. It doesn't mean that we all need to be walking around in that just yet. When we do, the health districts will let us know when we need to take those steps and take extra precautions. But right now, it's really about your own personal health and well-being and the care of your staff. So at the city, we're encouraging folks to stay home if they're feeling at all ill. We're trying to be flexible with our work-from-home policies, and I know some of our surrounding businesses have reached out to me to let me know some of the work that they're doing to do that. That's fantastic. Anything that we can do to kind of limit unnecessary public gatherings, or where people do, it's just anytime there's a flu or something like that. Those are the things. And then we, as cities, follow the health district's guidelines, and we're also posting information internally about CDC or any other updates. Encourage you to follow those information streams.
Thank you all for that important and valuable information. Now at this time, we have time to take questions from our Board of Health members or other elected officials that have joined us today. We're going to have two moderators kind of calling on people, and I am going to have two requests of you. We are streaming this live on Facebook, so if you could speak up so everybody watching on Facebook or on the phone can hear you. And then the second request is if you could keep your questions as concise as possible, just so we can get through as many as we can tonight. So.
Adrian Further-Manilis from the City of Edmonds. Dr. Spitters, can you explain a little bit about the schools and what's happening within the schools? We see some schools closing and some schools not. And what are your thoughts there?
Well, first, the school closures that have occurred to date have been at the discretion of the school districts. To date, the health district has not recommended closure for any school settings, and so, but it does bring up the question of in the continuum of social distancing efforts, when would a school closure make sense? And there's a couple of things come to mind. These higher level efforts to keep people away from each other, in this case children, who can then get together and then spread it out through their homes and networks away from the school. It has appeal in that sense that if you can break up their connections with each other for a while, you can break up transmission. The possible objectives that you're pursuing there have been characterized roughly as one of three. One is to just buy a little time to slow down the movement of an infection or a pandemic in a community. The other is to see if it has an impact on overall community-wide transmission. And then the third would be a much longer closure where you're waiting for some intervention to come forth, a vaccine, a treatment, that type of thing. So those are conceptually the reasons you might pursue that. Generally, the more transmissible and the more virulent, if you will, the worse the illness and the easier it is to transmit, the more the risk-benefit might favor considering that. So those are certainly things that are under consideration and being discussed. I've had a discussion or two with the state health department. We're not at a place where that is something that we're thinking about recommending imminently, and may not end up recommending at all, depending on the course of things and what the collective judgment is about these things. But that's it's certainly an item worth considering, and it could have benefits, but there are also side effects. The parents that take care of those kids, what are they going to do during the day if the kids can't go to school? We don't want those kids getting together somewhere else. That defeats the whole purpose of splitting them up. So those are just a couple of the branching impacts that we have to consider on the risk-benefit. So there you are. So a thought in process, but no clear answer.
Can I just add something? Some of our residents have been reaching out about things like, daycares and swim centers and senior centers and what to do. And I think we really do have to wait and follow the health district's guidelines on these things. I know it can spark concern, and if you're concerned, do what you need to do as a family to take care of you and your family. But we will wait for those directions to come from the health authorities on what we should close and when and why. So.
City of Glenwood, what advice do you have for public transportation folks? What can they do to lessen picking up the disease from those particular transportation options?
So for the operators of the vehicles, or
I'm thinking of the riders.
the riders? Well, I think that the best protection for whether you're jumping on a bus or going into a building or going shopping, I think it's all the same things. You're coming into the space shared with others who might be sick, and you might be touching things that they touched recently that have the droplets on them that could be the next common cold, influenza, or coronavirus that could subsequently become yours. So wash those hands. And when you leave, try not to touch your face, nose, eyes. And then, again, there's a huge cooperative part of this. Though the rest of us, if we're sick, we need to not go to those places.
Would it be helpful to carry sanitary wipes with you, or does that go too far?
Well, it certainly would do no harm to others if we went around wiping down the buses, whether that's sustainable. One of the things that were, as you might have seen or heard, there's no hand sanitizer on the shelves in any stores anymore. And we're having similar difficulties in the healthcare sector with some of the personal protective equipment, as we call it. Masks, goggles, gloves, those are starting to be exhausted. That's a challenge. So I think the main thing is to focus, the focus on others would be to keep out of circulation when you're not well and stay out until you've been well for 1 to 2 days. And then for your own protection, if you have hand sanitizer, carry it with you and use it. And if you don't touch your hand, face, or mouth. Don't eat until you've washed your hands. And I walked around the room earlier today shaking a lot of hands. That's our culture. It's a means of connecting with people. I'm not going to say stop doing that, but if you did choose to stop doing it, we shouldn't characterize that as weird. And if we are shaking hands, all of you, I'm not sick, but anybody that shook my hands, wash your hands before you, go home and eat. I can't tell you more than that.
Elizabeth Crawford, City of Philadelphia. I was wondering how we can assure that the proper message of directive gets to the proper people, such as the senior home directors, pool directors, school officials.
Well, one of our focuses, especially in the past 72 hours, as this event has really started to escalate, is really develop a sector-specific suite of messaging to go out. So we've been working specifically with partners to really have forums where we can go to their meetings and address their concerns directly, or produce informational messaging products that they can use to disseminate to their partners on their end. We have some intention of putting out some regular updates that will also be sector-specific, beginning here in the next week. So that's really some of the ongoing thing, and it's as we dig deeper, we continue to find new sectors, and in some cases, specialized groups within sectors that really have some very specific concerns, and we address those as best we can with the resources we have. But a lot of the advice is really focused on those basic things that Dr. Spitters has already mentioned, in conjunction for those that are ill with the protocols that are in place, with the healthcare system to make sure that we are taking care of everyone.
Jason?
Yeah, and I'll just add that Joint Information Center that the executive mentioned that we stood up. That follows the Joint Information System. So we have over 100 public information officers around the county who are linked together through that network. So anything that they produce is getting shared broadly throughout the county. And so as they begin to develop more proactively some of these messages, those will get pushed out through that system. And now that we have folks working on that, not that there weren't before, but additional folks working on that full time, those messages should be able to get pushed out much faster.
We had another question. You want to go? Yes.
Yeah, Judith, City Council, City of Snohomish, just a practical question, because I see you have to stay informed on these URLs and the web addresses, so which URL, web address should people go to for local? These are really good for the general, for updates, what you're talking about. Is it the health district? Yes. Yes. I just want, and is it something they have to click on, or will they just get on there and they'll read it?
Yeah, the health.
I know this is evolving, so I apologize.
The health district, so we just sent out a message to all our employees to follow for local updates on what's happening here in our local community. It's the health district website. Go to the health district website. There's information there. You've got a blog up. You've got all kinds of information going out on social media. It's fantastic. And then for kind of general information, you can go to some of the other ones.
Davy Martin with the City of Gold Bar. One of the things I do is volunteer with the food bank in Monroe, and I'm hoping that the food banks are being kept in this loop, because the more I think about the people that we serve and how we serve them, there's some real possibilities of transmission out there. Because you have homeless populations that don't have sanitation readily available to them. And that can be an issue. So, keep them in the loop.
Yeah, they are. We actually have on our staff someone who is specific job is to work with access and functional needs folks. So he's been involved in this since the start. The group that I talked about that we gathered today, that's one of the things we've already talked about. One of those folks was our Human Services Director. So we have someone who's going to be looking through that lens of access and functional needs and the Office of Aging and others. And then someone earlier mentioned transit, and community transit was there as well. So those folks are part of this right now.
I'm John Kartek. I'm the mayor of the city of Snohomish. I have a three-part question. Do we know how long this virus can survive on just surfaces like doorknobs and railings? And then do we know how long the incubation period is before a subject begins to show signs and symptoms? And do we know how long during that incubation period that someone might be considered generally contagious?
Sounds like something I should do.
That's probably
Okay, so let's take those one at a time. On surfaces, I think the virus is thought to maybe remain viable, is the term we use, able to infect for up to a few hours, not days, not weeks, a few hours. So if someone sneezes on their hand and opens the door, and then you're the next person or the next person or the next person that goes through that door, you can get that virus on your hand, and if it makes it to your eye, nose, or mouth, you can get infected. A day later, no. Okay, so there's that. The incubation period, that's the period from the time the organism enters the body through one of those sites to the time that illness is detectable, is an average of 4 to 6 days. The shortest, I think, that's been described is a couple days. There have been a few people out at 2 weeks. For public health purposes, we call the maximum incubation period 14 days. That's how long we watch people who have been closely exposed, and we're concerned about detecting them early if they get ill. And I've already forgot the third one. Could I ask you to?
During the incubation period and beyond, would someone be considered generally contagious?
So then duration of infectiousness, which is, for instance, well described with influenza. We know that a day or two before you get ill, definitely the last 24 hours before you actually feel ill, you're contagious, and you remain contagious until about 5 days after onset of illness. We don't have as much experience with this organism over time. We've just had a couple of months. We know that when people are coughing or sneezing, that's when they're maximally contagious. There have been some reports of what's called asymptomatic transmission, people who had a positive test but didn't feel ill or didn't feel ill yet, and when you connect the dots on who else was around them, maybe there was transmission. The experts at the State Health Department, though, tell me that, and tell us, if you sort of read their Q&A sheets, that those haven't been verified, so there's suspicion that asymptomatic transmission can occur. That would be either before you get sick or you got infected but you didn't get sick at all, and you maybe were able to spread it. But we don't think that's a major component of transmission. And then how long are sick people contagious? Well, certainly until they stop sneezing or coughing. And then again, maybe after they're better, we still can detect virus in their nose and throat for a few more days or even a week or two. It's conceivable that they could be contagious, but the mechanism for getting the virus out, through sneezing and coughing isn't there. So again, I can't give you definite limits on the front end and the back end of contagiousness, but we do know the majority